My name's Liz and I've got a respiratory condition for which my practice nurse has prescribed a Turbohaler. The information I'm giving you is a quick guide. You should read the instruction leaflet that comes in the box. In this video I will show you the important points of the inhaler, then I'll talk you through how to use it, and then I'll show you how to use it. At the end I'll talk to you about how I clean and store my inhaler, how I know when it's getting empty, what I do if I accidentally miss a dose or if I take too much, and why it's important for me to take my inhaler to the hospital or clinic with me. Now I have two turbo inhalers. I have a blue bottomed inhaler which is my reliever inhaler, which I take just whenever I need it. And for me that's sometimes when I get a bit breathless or wheezy, and that's very occasionally. I also have a red bottomed turbo inhaler. Your Turbohaler might have a different colour, but it's a preventer just the same. And it's really important that I take this morning and night whether I need it or not. The reason being, it's been given to me to control my symptoms and to prevent flare-ups. I've only took it just when I had a flare-up. Well, it wouldn't prevent flare-ups in the first place. And what I've found since taking my preventer regularly, I haven't needed to use my blue one as much, and I haven't needed any steroid tablets, which is really good. So my message to you is don't suffer, take your puffer. The Turbohaler is a dry powder inhaler, which means the drug is in a powder which you inhale into your lungs. Now the important points about the inhaler is this is the white dust cap which you twist and pull off. Here you have the mouthpiece. This is the middle bit which you hold, and here we have the grip which you would turn to load the device, and here you have the dose counter, and I'll talk more about that later. When I get a new inhaler, the first thing I do is check the expiry date that's in the bottom of the box. If it's out of date, you should return it to the chemist. When your inhaler's new, there is a piece of cellophane round the bottom. You can see the red arrows pointing down. To open the inhaler, just pull the cellophane down and pull it off. When your inhaler's new, you have to prime it. To do this, what you do is twist and pull the cap off, hold the inhaler in the middle, holding it upright. It's really important that you hold it upright, and then turn the bottom all the way one way and all the way back. You will hear a click. It doesn't matter which way you turn the inhaler, and then I repeat that. So again, turning it one way, then the other way to hear the click, and that's your inhaler primed for use. When you're using your inhaler day to day, you should use it at the same time every day, and you can take it with or without food. So I'm going to talk you through how to use it, and then I'm going to show you how to use it. Okay. So when you're using it, you should keep your neck in a neutral position, so just keep your head straight forward. You twist and pull off the cap. Hold the inhaler in the middle, making sure the inhaler's upright. Turn the bottom of the inhaler all the way one way, and then all the way back to hear a click. That's it ready. Then what I do is I breathe out, but when I breathe out I make sure I don't breathe into the device. Okay, just like this. Okay. After I breathe out, I put the inhaler in my mouth and I breathe in quite deeply, and then I hold my breath for a count of 10, and then I let my breath go slowly. So I'm going to show you start to finish. Okay. Twist and pull the cap off, holding the inhaler upright, turn the bottom all the way one way, all the way back, breathe out but not into the device, so and then okay. If I need to take another dose, I'll wait about 30 seconds and then I'll do the same again. So holding again upright, all the way one way, all the way back. Okay, and before I put the cap on, I just check the dose counter, making sure that my device is not empty, and then I just replace the cap. So after I've used my inhaler, I brush my teeth and I rinse out my mouth with some mouthwash. This is just to prevent side effects of the inhaler. Some inhalers can cause a wee bit of thrush or voice hoarseness, so I just avoid that by brushing my teeth and using a mouthwash. I clean my inhaler after each use, but you should clean it at least once a week. To clean it, twist and pull the cap off, dry tissue, wipe the mouthpiece, put the tissue in the bin and just replace the cover. The Turbohaler has got to be stored somewhere where it's dry. It shouldn't be stored somewhere where it's moist or wet. Personally, I keep my Turbohaler on my bedside table. That way I remember to use it when I get up in the morning, and it's then go into the bathroom and brush my teeth, and the same at night. If I forget to take my inhaler, I take it if I remember within an hour or two. If more than this, I just forget about that dose and get back on track with the next dose. I don't double dose because I've missed a dose. If I accidentally turn the grip twice, then I just continue to take the inhaler as normal. The extra dose is dropped into a hidden chamber so you don't double dose. If I accidentally take more puffs than what's been recommended, then I would call a healthcare professional for advice. I've done that once and I contacted the pharmacist and she said as long as I was feeling okay, not to worry about it. I know when the inhalers are getting empty because on the blue inhaler, a red line will appear when there are 20 doses left and it will disappear when it's empty. So when I see the red line, I will put in a new prescription. On this inhaler, there's a dose counter and it counts down. When it gets to 10, the numbers go red and then I know to put in a repeat prescription. It's really important to take a note of the dose counters because when you shake the inhaler, it might look as though there's some drug left in the inhaler. That is not drug, that's just drying agent, so always go by your dose counter. The coloured grips will turn even if there's no doses left, so again, go by the dose counter. When I'm going to the hospital or clinic, I take my inhalers and a repeat prescription with me. The reason being is that the health professionals usually want you to show them that you're using the inhalers properly. Also, sometimes they might not have your inhaler in stock in the hospital, so that's why it's important to take them wherever you go.